Thank you so much. All right. So I am honored today to speak on a path to migraine wellness. I'm going to give a brief introduction before three of my wonderful and outstanding colleagues are going to take you through an experiential session about how to help to achieve migraine wellness. I think everybody listening knows these facts that I'm just going to quickly run through. Migraine is a chronic medical condition, as Katie just said. It's much more than just a headache. There's no cure to date, and treatment traditionally is focused on the use of medication. One question: how can people with migraine feel like they have control over their disease? What are some ways to find resources and help? So trying to break this down, understanding the science of migraine, genetic and developmental factors can contribute. We know that migraine is indeed genetic. Even if you don't have somebody who's aware of the diagnosis of migraine in their family, there may have been somebody who had bad headaches or other features and just were not diagnosed in years gone by. This is changing. We're beginning to understand more and more about how migraines move through populations. They're more common in women than men. They tend to peak in the 30s and 40s, but they can be present in all ages. I think the youngest known person with migraine was a 2-year-old child, and certainly they can persist in people in their 80s and beyond. Migraine is a clinical diagnosis at this point. There's no biomarker specifically that can help us to make the diagnosis. I expect that to change. There's a lot of great research. And another factor is that there really is a paucity of headache specialists. I think there's fewer than 1,000 headache specialists in the entire country, although this is such a common condition. And so trying to get help for yourself or advocate for family members, friends, colleagues, other people with migraine, certainly a lot of work. And I know it takes up a lot of space. So just running through migraine quickly, again, with a crowd who really knows what this feels like, the process can actually start 24 hours before you actually feel anything. And some things that people describe to us before they get a migraine are that fatigue, sometimes a feeling of restlessness and a sense of foreboding. Something is going to happen. I know it's coming. And you all are so aware of what is happening in your body. Early signs are called the prodrome. An aura is distinct features that happen before a headache may begin, such as the visual changes, the flashes of lightning, the numbness on half your body, changes in speech, other things. The ictus, which is a word that means the event itself, is the headache part of the migraine, but that's not as much present for all people. For some people, it's the photophobia, and for others, the light sensitivity, and for others, it may be the nausea or vomiting. So it's a little bit different for everybody, and it's all part of migraine disease. The postdrome is that recovery period, and we all know that it can take a day or two before you actually feel back to yourself. So step one is recognizing what's happening, finding some kind of a medical care provider, and some good resources that you all may be aware of: the American Headache Society, the Migraine Research Foundation, Miles for Migraine. All of these are places where you can get more information. Ask friends. Pretty much everybody knows somebody who has migraine. When I made this slide, 38 million Americans had migraines, and that number is now up to 40 million in just a short amount of time. Ask your PCP, and oftentimes GYN providers, for people who have gynecologists as part of their care team, they may know somebody who's a specialist in treating migraines. And if the first visit is not a positive one and you leave feeling worse than you did when you started, or it's just not a good connection, please feel empowered to keep searching. It's not your fault that you have migraine disease, and the condition should not be minimized. So let's say that you've got a migraine specialist you've identified that you want to work with. What next? Well, gee, take charge. The diary is the biggest tool, the most helpful thing for me when a patient comes into that first visit and has brought his or her, their diary with them. That's really helpful because that gives me some data to look at with them to start composing a plan for how they can start to feel better. And please log everything that you think might be important and influential: your menstrual cycle, sleep, exercise, and food. Stress is important. We are still in this pandemic. We're all hoping to see the light at the end of the tunnel, but the stress plays a role, and you're going to learn some techniques today to really help you deal with that stress. Bring that diary to your visit or send it electronically if you're able to ahead of your appointment. When people do that in my practice, I look at those before I see them so that I've got a heads up on the visit time, and study it yourself. Remember, nobody knows your brain as well as you do. Make a list of the treatments that you've tried, medications, drugs to make migraines stop, drugs to prevent migraines, any of the newer biologics. Have you tried Botox? Have you tried an elimination diet? Have you done any of the mindfulness work, craniosacral therapy that you're going to learn about today? Whatever you've tried, we want to know about it and see if it's helped you or not. Lifestyle, things to think about, exercise. Are you hydrating? Are you sleeping? What's your stress look like? And what is homeostasis? That's a word that we talk about a lot with our group who are present on this Zoom today. It's really keeping your brain, keeping things the same all the time. The brain does not like uncertainty, right? Especially for migraine brains. Change is that much harder. So the more you can do to improve your homeostasis, your overall wellness, the better. And schedule your time, make a plan. I'm going to get my exercise here. I'm going to drink my 2 glasses of water here. I'm going to get my sleep every night when I schedule it. The more that you can do that and think about it, the better your brain is going to feel. So, you know, for all of us, right, we're all sick of looking at this picture of a coronavirus. The pandemic has just pretty much unseated everything, right? And it's added to stress in every way. Family, job, kids in school, finances, loneliness, isolation. I'm hoping that that's better for everybody as we're able to carefully begin to maybe re-enter society a little bit, wearing our masks, right? Thinking about protecting ourselves and protecting people around us. Fear, anxiety around getting infected have really been determinative for the past 20 plus months now. Migraine mayhem, right? When so much control is lost, for all of us, it's been difficult. And for those of us with migraine, it's been that much more difficult. So what's the path to migraine wellness? Well, I hope you're going to learn that from my colleagues this afternoon. Things that focus on your mind, on your body, on your spirit, and your fitness. It's a combination. These are things that all of us as human beings in this world need to pay attention to, and particularly so for people with migraine. So work with your team, use what you know best, make a schedule, stick to healthy habits, line up your care providers, see what you can do virtually, plan ahead, shore up your support, and create boundaries. Oftentimes, I have resources that I'll share for like a 10-minute yoga session, let's say, and when I'm seeing people on Zoom or sometimes coming into the office and we're wearing masks and I'm wearing my goggles and I joke with patients that I'm wearing my Darth Vader gear, you know, I'll say to them, you know, there's very little in this world that we can't do for just 10 minutes, or maybe it's 5 minutes, or maybe it's 2 minutes. Just making a plan and trying to stick to that plan is going to help. Things that aren't helpful for people with migraine: dismissive treatment, being told migraines are the least of it, especially during the pandemic, minimizing the disease process, not being able to give yourself some space, and being caught in an anxiety loop. And again, I hope and expect you to all learn some techniques that are going to be helpful with this today. So trying to limit screens has been really difficult, right? I put a big screen on this slide. Let's face it, that's pretty much impossible right now, she says, as we're all on Zoom. But, you know, taking screen breaks, the hospital where we all work, our speakers today, has this 20-20-20 mantra: for every 20 minutes, focus your gaze 20 feet away from your screen and hold it there for 20 seconds. Something you can remember. Do I do it every 20 minutes? I try. I can honestly say I'm not sure I do it every 20 minutes, but I think it's good to stand up, stretch, just clear your vision if you can, if you're stuck working in front of a screen. I put here a couple of the different kinds of integrative therapies that are useful: chiropractor, movement therapy, yoga, integrative health coaching, integrative nutrition, acupuncture, craniosacral therapy, meditation and mindfulness. We're fortunate in that we have all of these things in our integrative health center at Brigham and Women's Hospital, but you can line a lot of these up yourself, and I hope that you'll get some good ideas today. Support from other people with migraines. You just heard that beautifully expressed by Katie. Join Miles for Migraine if you haven't. Become part of this community. This is really helpful just to know other people who have the same illness that you have and to share from each other, trade tips and ideas. So on the agenda for this afternoon, mindfulness and meditation, craniosacral therapy definition, and then some ideas you can use at home, and then migraine nutrition with the demonstration. We wish that we were meeting all of you in person. Maybe not right now, but we wish that the world were different and really hope that one day it will be. So we're so glad you can join us. Our goal today is that everyone will learn at least one new thing about migraine wellness. Thank you so much for being here, and it's going to be an exciting afternoon.
Second, I am on mute. Thank you so much. That was wonderful information and a lot of information there. I took a lot of notes I love your passion about migraine. So thank you very much. And I can't wait to hear the rest. So next, I would like to introduce